strengthening our security and tracking systems, end-to-end visibility systems. And also, we are constantly talking to our partners to see how we can continue engaging and building our trust with them. And also, we've continued to collaborate with the Ministry of Health to meet high standards and targets. We do not see a situation where we will have shortages. Because remember, from the announcement, I think it was mentioned that the $50 million will be withdrawn in January 2026. It hasn't yet been implemented. So what we've done as ZAMSA, of course, we had early this year a forecasting and quantification exercise where we planned what medicines we need for the next 3 years and how we should prioritize that. So we've covered all those aspects, and we do not foresee a situation where we will have out-of-stock situations or shortages as a result of that $50 million withdrawal by the US aid. Of course, it also gives us an opportunity to plan more effectively, given the resources that we're given, because as you know, we are currently sitting at a budget of 4.9 billion kwacha that has been allocated to us by the government of the Republic of Zambia to buy medicines and medical supplies. And I must give credits to the government because I think this is unprecedented, because in 2021, we had a budget of 1.5 billion kwacha. In 2022, the budget moved to 2.6 billion kwacha. 2023, we moved to 3.6 billion kwacha. And 2024, we moved to 4.6 billion kwacha. And currently, we are sitting at 4.9 billion kwacha. And this is the reason why we've seen an increment in terms of availability of medicines and medical supplies in the country. So we are, as ZAMSA, would like to implore the general citizenry and the populace that there should be no worries, because we do have adequate supplies. We are currently sitting at 71% availability, which is above 70% threshold recommended by the WHO, World Health Organization. So we plan, for instance, ARVs 5 months ahead. So we don't see a situation where we will have an out-of-stock situation.
All right. You can be part of the conversation. The phone lines are open. The numbers are 0955 997 997 or 0979 192 485. Joining us in the studio for the Power Breakfast, we are joined in by Senior Manager Corporate Communications for ZAMSA, Mr. Bradley Chingobe. Now, the other conversation is counterfeit medication, which is a global challenge. How is ZAMSA ensuring that medicines reaching patients are safe, effective, and, of course, of high quality?
So I think those are some of the issues that we face when we're procuring medicines and medical supplies in the country, is to ensure that the medicines that we buy have the right efficacy levels. And efficacy, we're talking issues of what may be known as active pharmaceutical ingredient, not having fake medicines, not having counterfeit medicines. And how we do that is we ensure that all the suppliers that bring drugs to ZAMSA adhere to strict World Health Organization standards. And we also have pre-inspection processes where we do make sure that whatever we procure is pre-inspected. And also don't forget that everything that we procure in terms of medicines is regulated by the Zambia Medicines Regulatory Authority, which is ZAMRA. So ZAMRA does their own testing to ensure that the medicines that we have at ZAMSA meet the required standards. If ZAMRA does not give us a certificate of analysis or consent, or if the medicine does not pass the ZAMRA test, we are not allowed to distribute that medicine. So I don't know if you've seen situations where you've had stories or media updates where we mention that such and such a product has failed the test and we're withdrawing it from the facilities, or we are not distributing it. It's in a case where it has failed the test. Of course, there are situations where medicines pass the test, but because of how they are stored, where they've gone to, or how they are transported where they're going, there is a chance that maybe they can have a challenge and fail the test as they go there. But that is why ZAMRA is there. And they do what, they go into the market themselves and go and test, despite doing a previous pre-inspection and pre-test process, they still go and test those commodities to ensure that they meet the right efficacy and safety standards. And without even just ZAMRA, we as ZAMSA have our own internal system, where within ZAMSA we have a lab where we do our quality assurance tests and lab tests to ensure that our commodities meet the right efficacy levels. And therefore Zambians should not be worried that what they are receiving is expired, is counterfeit or fake, because we do all the required tests to ensure that they meet all the requirements.
And so now going to, when it comes to audits, I'm sure usually when we have findings from that, a lot of people have got their opinions when it comes to that particular matter. How exactly does ZAMSA ensure that you're cooperating with I would say the members or the personnel that are taking or rather instituting the audits, but also ensuring that once findings are released, that you're leveraging those findings? What steps do you take as ZAMSA?
I take it we're referring to the forensic audit that was recently done.
Yes.
Of course, that is a very active investigation that is taking place, and it's very, very difficult for us to speak to it as ZAMSA, because obviously the due process has to be done, and we need to allow the law enforcement agencies to do their part of their work. And which I must state here that we are alive to the fact that there's a lot going on around that forensic audit in terms of ZAMSA, because we do see the law enforcement agencies coming to our offices, interrogating, interviewing and interrogating members of staff and processes, and reviewing a number of issues and documents as well. So we do know that that is a very active investigation. And as ZAMSA, one of the first things that we're doing is to ensure that we fully cooperate with the law enforcement agencies to ensure that all those issues raised in the audit report receive the attention that they deserve. Of course, at the end of it, we will all know the results of that. But I think we are also paying attention to some of the things that are being raised, and seeing how best we can manage and prevent them as ZAMSA through our own internal processes. So we, like I mentioned earlier, we've got an audit team, a very capable audit team and department at ZAMSA that does internal audits, and we are very alive to the fact that we are paying very strict attention to what is going on, and also adhering to recommendations that are stipulated in the report.
Now, you earlier on in your preamble, you mentioned that you do collaborate with the Ministry of Health. Some patients still buy medicines out of their pocket. You know, they go to the hospital and they are told that we don't have this drug is not available, you will need to buy it at the nearest pharmacy because of shortages in public facilities, hospitals, clinics. So now, how does ZAMSA come into this conversation? What assurances can ZAMSA give to the public that this situation is definitely being addressed?
I think one of the first things that we're doing, obviously, is these media engagements, and we want to bring to the fore our role as ZAMSA, and we want to make it very clear that we are distributing these medicines. So when we make it clear, I think the conversation now tilts. It's no longer about distribution, but it's about access to medicines. Because if people hear that we have actually distributed the medicines, they do expect to go to these facilities and find these medicines. So we know that this is obviously having a ripple effect in terms of people expecting to find medicines. And I do get, every time I have a media engagement, I'll get somebody reaching out to me and saying, look, I went to this facility, I didn't find drug A, drug B, or whatever it is. So already that to us is something I think we're doing positively. We are also working with the Ministry of Health to ensure that we have more adequate control mechanisms in ensuring that people do access the medicines that have been distributed by ZAMSA to the facilities. Because it's one issue not to access the medicines delivered by ZAMSA, and also it's another issue when you don't find medicines that have not been delivered by ZAMSA, because they will definitely not be there. And this is where now I think we need to make a distinct differentiation in terms of what is essential medicines and what is not essential medicines. And I think it's time that as Zambians we take interest to understand that the 4.9 billion kwacha focuses on buying medicines for the most predominant or most common illnesses in this country. We buy medicines for disease that speak to the public health needs. And these, if you take just mere interest, it's very easy for you to know what are the major concerns in terms of diseases in this country. A simple example is you know that we have issues of HIV, we've got issues of malaria, we've got issues of non-communicable diseases, communicable diseases, and a number of illnesses that that require essential medicines. But there are certain things that are, yes, they are illnesses, but we will not call them essential, because they do not affect as many Zambians as, for instance, as malaria. You understand? So as ZAMSA, we focus, or the government will focus to buy medicines for the biggest challenges in this country. And because we have a limited budget, we do not have a budget of 30 billion kwacha. When we have 4.9 billion kwacha, we will prioritize that which is most important or what is most needed. So those are the things that we buy. So there are certain medicines that you will not find in facilities, and those are not essential on our list. So I'm sure when we speak 70%, when we speak 100% or 90%, you're wondering how we arrive at that. So what we do as ZAMSA is we, through our cooperating partners and through Ministry of Health, we do what we have a tracer drug list. So that drug list is what we use to monitor and evaluate the percentage or availability of medicines in these facilities. So what we do is that the tracer drug list has itemized medicines or commodities that should always be in the facility. So for instance, malaria. So we'll pick maybe one commodity or medicine, and we'll say coatem. And our standard is that we will expect that every time we go to the facility, we find that coatem, and we'll count it as one. And then we go to HIV, we find that commodity that we'll choose one of the medicines used for HIV and use it as also a standard by which we measure the availability of HIV drugs. So that's how we measure the availability of drugs. There's a list of tracer drug lists, and when we have all those commodities in the facility, then we know that we have spoken to all the illnesses or responded to all the major illnesses in the country.
Once again, this is Voice of the People. Do remember you can be part of the conversation. Do call us up. Send us a message. That's on 0955 997 997. And well, now, going back to, I would say my other question would be, for now, the person who's listening and saying that usually when I go to a public health facility and let's say I need a particular drug, I'm told that it's not there. But then you find either later on you hear of stories of actually workers at these public health facilities selling the drugs that are supposed to be given to those who need them. How exactly is ZAMSA tackling thefts of, for example, antiretroviral medicines, especially like we heard at UTH? How are you strengthening security to protect life-saving medications such as HIV medication?
That's a reality, Shekinah. We do face those challenges and reports of pilferage. I'm sure you see sometimes in the media that medicines are being pilfered and people have been arrested for pilferage of drugs. And we do take these concerns very seriously as ZAMSA. And we will continue to strengthen our security and tracking systems. So one of the things that we are doing, and I know that we've reached very advanced stages, is to introduce an end-to-end track and trace visibility system. And with this, we are hoping that we will be able to monitor the procurement of medicines and medical supplies from the level of the manufacturer. So when the drug is being manufactured, we know where it's been manufactured from. We know that where the drug is, where the supplier has bought it from, and then we're able to track it from, let's say, India all the way onto the sea when it's being couriered. When it reaches the Dar es Salaam, the port, we're able to track until the drug enters Zamsa. We're able to see where it's sitting, the location, if it's in the hubs, or if it has gone to a facility, or it's on the road to Chiengi to a hospital. We're able to track that drug. Once it enters the facility, we're able to monitor and trace it until it's dispensed to Fortrace. And then we can be able to tell that this drug, there were 10 drugs, one of them has been dispensed to Fortrace, so we have 9 drugs remaining. So we are hoping that that system kicks in as soon as possible, because we know that this is definitely something that is going to be a game changer in terms of pilferage of drugs. Within ZAMSA, of course, we have very strict security measures, ensuring that there's no pilferage. And I can make mention here that in the last 3 years, we've not had a case of someone at ZAMSA being arrested for pilfering drugs, because we do have a digitized system within ZAMSA that shows the receiving of the drugs, the storage of the drugs, and the distribution of the drugs, the warehouse management system. So it's not easy to actually pilfer within the system because everything is digitized. We do have CCTV cameras, and we recently engaged the Zambia National Service to beef up on security as well. So in terms of pilferage within ZAMSA, I think we've done our homework. Of course, where we do have the challenges is in issues where the drugs are self-collected by the facilities, or what happens after we we distribute them to the facilities. Because our mandate only allows us to drop the drugs at the facility. What happens thereafter, we have no oversight, and we have no control. So that is where the challenge is. And this is the gap that we hope the end-to-end track and trace visibility system will be able to close in.
In your view, how far are we from local manufacturing of medicines and medical supplies to reduce import dependency? Like you earlier on alluded to, sometimes we do get aid, medical aid. So if we need to tackle with certain diseases, if maybe as Zambia we start manufacturing our own medication, is there a possibility of that as you collaborate with the Ministry of Health?
Fortrace, interestingly, as we speak today, we do have in the country a company called Akums from India that has come to do a joint venture with ZAMSA.
Yes.
And the whole idea is to manufacture medicines within Zambia. And the joint venture will be set up in M-Phase, and we will be producing 150 essential medicines locally, which is a huge step in terms of manufacturing medicines in Zambia. Because as you may know, we only have about 5% out of the entire medicines that we use in this country. Only 5% is locally generated or produced. The rest is imported in the country. So we're hoping that this is one of the first, or this is the first of the many initiatives where we're going to have locally produced medicines, essential medicines in the country. And we besides that, we also do prioritize the procurement from local manufacturers. And I think government has made it very clear that to build capacity to local manufacturers, we should not buy a medicine produced in Zambia outside the country. So that is another way we support the local manufacturers, to ensure that if they produce something, we do not buy it from outside the country. And also we do, as ZAMSA, support the issue of infrastructure development, and also aligning distribution systems and regulatory compliance, because medicines are issues of safety, and therefore we need to make sure that even the local manufacturers are there to GMP practice and also ZAMRA guidelines and specifications. So we are happy because we know that our policy, and as things stand, we do support companies like Yash Life Sciences, which is a local manufacturing company, Pharmanova, and a few others. We have very few drug manufacturing companies in Zambia, but we do support those, and we have a bias towards local manufacturing companies.
So taking you back just a bit, how exactly or on what manner does ZAMSA have in which, if let's say if it's healthcare worker or even the patients who are receiving medicine, how can they report back if they've noticed that there's a drop within the quality or the availability of medicine that should be in a particular health facility? Is there a way in which they can reach out to ZAMSA?
So we do have a customer services department at ZAMSA that interfaces with the facilities. And it's through this channel that we do communicate with the facilities because they are our major stakeholder in terms of, in a business you would call them your customers. But these are the 3,500 facilities are the ones that our customer care services department takes care of. So we do have a constant daily interchange in terms of the performance management of the commodities that we distribute to them. So we are able to get feedback from the facilities using that mechanism. Besides that, of course, like I mentioned, we've got other stakeholders like ZAMRA that do on-spot checks at these hospitals and these facilities. They randomly go and do their inspections to check if the commodities sitting on their shelves do meet the right safety and efficacy levels. And once they notice there's something wrong, they quickly ask that we record that medicine.
Okay. So no whistleblowers, no possibility of that?
So we do have a whistleblower policy at ZAMSA, and we are actually in the process of reconstituting the whistleblower policy because we are revisiting it and reviewing it alongside the Anti-Corruption Commission. And also we do have an integrity committee within ZAMSA that manages the issue of reporting all issues of malpractices or anything that you see suspicious happening. And that integrity committee has a level of escalation to the law enforcement agencies or relevant parties. But I should also make mention that we recently took part in the anti-corruption orientation of the anonymous whistleblower online system, which is a digital system now where people are able, including yourself, Shekinah and Fortrace, you are able to anonymously report any malpractices. So we hope that people will actually utilize that to bring out any issues surrounding the pilferage of medicines in Zambia, because, like I said, 4.9 billion kwacha is a lot of money. So there should never be a situation where you are made to buy drugs that should be availed to you for free. Yeah.
Okay. Now, as we'll be moving forward, ZAMSA's long-term, what is ZAMSA's long-term vision of 5 to 10 years in the medical supply chain?
Yeah, so we as ZAMSA are committed that we need to improve the availability of medicines and medical supplies distribution across the country, and by doing so, we know that we've already met the WHO benchmark of 70%, but we want to push higher and possibly sit around 80% availability at central warehouse, because what we know is that when you sit at even just at 70%, it has a cascading effect to the 3,500 facilities across the country, because what it does is that the result is that, to give you context, is that the primary health facilities, the health centers and the health posts, which are the bulk of the hospitals or the facilities, are 3,400 of them across the country. And these are the ones you find in the rural areas, in the remote areas. These are sitting at an average of 92% availability of medicines. And part of the reason has been the provision of the health center kits that we have not failed to distribute in over in about 3 years, we've constantly, every second month of the year, we've taken health center kits to these facilities. And as a result of this, it has transformed the availability of medicines at that sector. And that is why they're sitting at 92%. The secondary level facilities, these are the district hospitals, are sitting at 75% availability of medicines. And the tertiary level facilities, these are the teaching hospitals, these are the ones that are sitting at about 74% average availability of medicines. And then the specialized facilities, cancer disease hospitals, renal, eye specialist hospitals, those are the ones that are sitting at 57% availability of medicines. But I need to make mention that for the very first time this year in our forecasting and quantification, we did look at issues of renal and cancer, because those are diseases that are also on the upswing.
Yes.
And we've planned for them. Forecasting and quantification basically means planning for a certain disease in terms of demographic, population, and the type of medicine that you're buying for that illness. So we plan for them. And I think the bigger news around it is that we've entered long-term framework contracts, because we previously had issues with commodities for renal, for instance, Nipro bloodlines, but we've managed to contain that by engaging suppliers on long-term framework contracts, where we'll continuously be able to receive medicines and procure medicines with no gaps. And this is the reason now that we've shot up in terms of renal to about 69% availability. Yeah.
Okay. Now, as we are wrapping up, maybe you would like to share with Zambians regarding ZAMSA's commitment to improving access to essential medicines and health supplies as your final words.
Yeah, so the new Dawn administration obviously has set very high standards and targets in terms of healthcare in our country. And to respond to that, as ZAMSA, we are very committed to ensuring that we achieve these high standards and targets. And as ZAMSA, we remain steadfast in ensuring that every Zambian has access to quality healthcare, safe healthcare, effective and affordable medicines across the country. We will also work in ensuring that we digitize our systems and continue to embrace transparency and work effectively to build a healthcare supply chain system that serves all Zambians regardless of their location or proximity in the country.
All right. Thank you very much for coming through.
It's been a pleasure, and we look forward to more engagements.
Indeed.
Thank you.
All right. This has been the Power Breakfast, Voice of the People, right here on Power 91.3 FM. And in the studio, we were joined in by Senior Manager Corporate Communications for ZAMSA, Mr. Bradley Chingobe. And Voice of the People, this has been Voice of the People. The breakfast show continues on the other side.
Wake up to the best in music, news, entertainment with Power Breakfast.